a small video which will demonstrate our surgical technique. This is a lady that needed a sinus graft on the upper right side. As you can see on the CT, she has no bone to begin with. She has only cortical layer of about 1 millimeter and a thickened membrane on top. And the question is, how should we place implant in such narrow bone? Because we will not get any primary initial stability. So let's look at how we are doing this process. The first would be reflecting a mucoperiosteal flap. So we do a mid-crustal incision with a vertical cut in the arterial area, and we lift up the flap buccally. Lifting up the flap buccally will reflect the underlying bone, which is the lateral wall of the sinus. Since extractions were done before, we take all the granulation tissue out, and you see that we left also with a dehiscence on the buccal aspect. We scrape some autogenous bone with a bone scraper, and we will add it to our grafting mixture. This is our burr that we outline and do the window, diamond burrs with a straight handpiece. And now, delicately, we lift up the Schneiderian membrane upward, very carefully, not to perforate the membrane. After lifting up the membrane, the next step would be, of course, to do the osteotomies. We dry the area a little bit so we can have very good visibility of where we are working. And you can see very nicely and clearly how the membrane is intact, and when the patient breathes, the membrane goes on top. So right now we are ready to do our osteotomy for the fixtures, and the treatment plan here was to place 3 implants for a fixed restoration. So we drill the first site, and in this site we had some initial bone to gain stability for our implant. We put a parallel pin to parallel our osteotomies. This is our distal osteotomy, and you see that we don't need almost to drill, maybe 1 millimeter. And we are using tapered implants in all our sinus cases in order to get a primary implant stability. You see that we also prepare the third site. This is the grafting material that we were using, the Puros allograft. We mixed together with the graft our autogenous bone that we harvested before, and we apply our PRP solution to the grafting material. And in order to activate this solution, we need to add our thrombine, and we use human thrombine in order to avoid the potential danger of the mad cow disease. So we mix it with our human thrombine, and in a few seconds after mixing we have our graft ready for use, as you can see here. So now we place our grafting material into our sinus compartment, condensing it to the medial wall, to the palatal wall, trying not to have voids between the particles, And you can see here very clearly that when condensing the graft, we can even shift the fixture because we don't have enough primary implant stability. But that should not be a problem if the patient will not wear his removable partial denture. So we add more grafting material till our window will be fully loaded with our grafting material, which will cover all the implants in all aspects. And of course, a membrane should be used on the window in order to avoid penetration of soft tissue inside. So right now we finished up packing our grafting material. We are almost done. We need to place the membrane, and we are using a collagen membrane, as you can see here, again mixed with PRP. And again, applying our thrombine in order to activate the platelets. So the membrane is ready. We bring it into place. And now suturing up the flap primarily. Care should be taken not to have any tension with the flap, because opening of the flap might cause a lot of problems, inflammation, and we can lose the entire graft. So we are almost done. And this is how it looks like when we finish up suturing.